Hi everyone, and welcome back to my channel, Dr. Coco's Medmonics. Today I'm going to be going over heart chamber pressures, and I've gotten a lot of questions on this as far as like UWorld and NBMEs, and they'll list the different pressures of the heart, and they'll ask either where are you in the heart or where is the problem in the heart. And so I came up with a little way of trying to figure out the flow in the different pressures in the different chambers of the heart. And so I drew this picture out, and it might look a little confusing at first, but here we have the SVC, the IVC going into the right atria, right ventricle, pulmonic, pulmonary veins going into the left atria, left ventricle, and out the aorta. And so I wrote down the different pressures over here, but I also hand wrote them out here. And a pattern that I noticed is that you should have some pressure that will carry over between each section. And what does that mean? So in the right atria, we have around five. Different books will say different things, but it's about around 5. And so if you have in the right atria a 5, you want to carry that over, okay? So whatever number this is, say it's 4 instead of 5, then the right ventricle will have a 4 in the denominator. If there's not a 4 in the denominator that matches up to the right atria, then you have a problem with that tricuspid valve over here on the right side. So you know that these have to carry over. Next, we have a 25/5 in the right ventricle. If that 25 doesn't carry over to a 25 in the pulmonic, then you know that there's a problem in that pulmonic valve. So the 25 should carry over from the right ventricle to the pulmonic, and then it'll be 25/10. Now the 10 here is going to carry for a couple different chambers, and it'll be about 10, somewhere around 10. I think first aid has it as 12, or an amboss might have it as 10 or something, but as long as this number is the same and you don't go from like 10 to 8 to 7 or something, because then you know that there's a problem. So we have this 10 in the pulmonic denominator that's going to go to the left atria. And another key thing that helps me is if you remember that the atrias are both just one number. It's not like something over something. The atrias are just one number, and then the rest of it is going to be a number over another number. So right atria 5, left atria 10. Or somewhere around 10, 12, somewhere. Depends on the source that you use. And so if you go from the left atria to the left ventricle, that 10 should go to the denominator right there. And if it doesn't carry over, then you know that there's a problem in that mitral valve. And then you have 130/10 or 120/10, you know, every source is different. That 130 should carry over to the aorta. And so then the aorta will be 130/90, or maybe it's like 120/80, whatever your book says. But you have to know that this number is going to carry over. If not, you're going to have a problem in your aorta, maybe a stenosis or something. I hope this helps. Just trying to remember the atrias will be one number, everything else will be something over something, and then that you have to carry over these numbers between your chambers. And so if you have a question stem and you go through all of these, you know, try and like write them in order if you have time. But if not, you can just look and say like, okay, well the left atria is at like 15, but the left ventricle is like 130/5. Then you know that's going to be a problem somewhere between the left atria and the left ventricle. Hopefully this helped you guys. If it did, like and subscribe to my channel.